main cause is, as I told you, abnormal and excessive discharge, electrical discharge from the brain. There could be various reasons for that. As I told you, it could be either primary epilepsy, wherein these discharges are because of the chemical changes, or it could be because of the structural problem of the brain. That could be because of various reasons. It could be because of lack of oxygen at the time of birth, accident, head injury, any brain tumor, or any inflammation in the brain, any affliction of the brain because of any infection. So all this can lead on to epilepsy or seizures. As I told you, the epilepsy is characterized by repetitive seizures. Now, what are the symptoms of seizures? As I explained to you, there could be grunting sound followed by stiffening of the body, jerking of the limbs followed by loss of consciousness. It could be associated with incontinence and tongue bite. And after you regain consciousness, you are confused for a while for 10-15 minutes. This is known as generalized tonic-clonic type of seizure. There is another type of seizures which is known as complex partial seizures. In complex partial seizure, you are conscious but you lose awareness or touch with the environment and you start behaving in a bizarre manner. So for few minutes or few seconds. So this is known as complex partial seizure, and during complex partial seizure there could be some repetitive behavior, like there could be smacking of lips or some automatic movement of the hands or lips. So all this can occur during complex partial seizures. Or there could be just partial seizures wherein only part of the brain is involved and there is jerking of the limb that is confined to one half of the body or one limb, upper limb or lower limb. So and sometimes in children there could be just transient lapse of consciousness. I mean, patient will lose contact with the external environment for few seconds, then will again resume the activity without losing consciousness and without any obvious jerking of limbs or any other obvious sign. So all these could be signs and symptoms of seizures or epilepsy. Majority of the epilepsy patients can be treated medically with medicines, but sometimes, rarely, in some few percentage of the cases, epilepsy could be refractory. We label it as refractory when a patient failed to respond to two or more anti-epileptic drugs which have been tried in their optimal dosages for at least 2 years. Then we label these epilepsies as refractory epilepsies. So we have different options for refractory epilepsies. One can go for surgery or one can go for some implant like vagal nerve stimulation or deep brain stimulation. So all this can be tried in those patients who have refractory epilepsy, but majority of epilepsy cases can be medically treated with anti-epileptic drugs. First aid for a patient who is having active seizure is, first, if there is any tight clothing or any button around the neck, that should be loosened, and you should try to make them lie on their side or with their face down. Don't try to feed these patients with water or anything, and don't try to open their teeth, and don't try to restrain the movements. All these jerky movements will subside in 1 minute or 2 minutes, and once patient seizure has subsided, make them lie on a flat surface. And if there are recurrent seizures, I mean patient is not regaining consciousness in between two seizures, then this patient should be immediately rushed to nearest emergency.